The Pediatric Lounge, a podcast taking you behind the door of the physician's lounge to get a deeper insight into just what docs are talking about today. From the clinically profound to the wonderfully routine and everything in between.
Okay, here we go.
Good morning, George. How are you?
How you doing, Dr. Bravo? Another wonderful day for another wonderful podcast.
Hey, George, do you know who's going to Denver in November 10th and 11th?
But with that, a celebrity, I think I heard.
I think he's infamous. Do you know what he'll be doing there?
He'll be talking probably about type 1 diabetes, some type 1 diabetes screening in their private practice, as he usually does.
Yeah, so I'm so humbled and honored to be invited to the 8th Symposium on General Population Screening for T1D at the Barbara Davis Center for Diabetes. If you don't know the Barbara Davis Center for Diabetes, it is the world's premier research institution on type 1 and other forms of diabetes. I will be joined by some really interesting people November 11th at 8 a.m. Nicole Sheehan will talk about reimbursement. Anastasia Albanese O'Neill, who is one of the co-authors of the consensus statement presented in Europe about universal screening. And my presentation will be We Can Do This. And then we'll listen to a good friend of us, Dr. Martha Middlemist, who's out of Denver. She was formerly on the board of directors at the AAP, and she will talk about the limits of primary care. I will drop the link on the show note. It is virtual and in person, and it is provided free, so you don't have to pay. So at least tune in to listen to us pediatricians talk about how we're going to move screening forward. And George, who's going to BMI?
I'm going to be going. I think you're going.
Looks like I'll be going, and I think Kristen's going to be going too.
Yep. And my partner, Milton Sharp, is going too.
Oh, I love to see Milton.
Yeah, he's great.
So that's going to be the 5th of February in New Orleans next year.
It should be interesting. All right, let's take the show on the road. Today's topic, what's happening at the ACIP, what these decisions could mean for your practice. Who do we have on the show today, Herb?
We have a really great friend of ours, Dr. John Kane. He is our statistician and internal evidence-based reviewer. And then we have Kristen Strebel, who's a great friend in Arizona, and she is our expert nutritionist.
Struble.
True, I would say.
I know, it's a hard one.
All right.
Welcome to the show, guys.
Thanks for having
Great
us.
to be here.
Yeah.
I don't know. Where do we start? Let's start by
From the Crossfire. There should be a lot of Crossfire going on.
So let's start by the simple thing. What did the Trump administration and Secretary Kennedy do that made the white coat organization so mad in regards with ACIP? John?
They're blowing up the whole infrastructure of public health, apparently.
So they fired all the old geezers and brought in a new team.
I read Caitlin Jetelina's blog today, and apparently there were another 1,300 or 1,500 fired over the weekend, and then they thought better of it and rehired immediately 700 of them back. It doesn't sound like it's an organized effort to improve efficiency and improve quality. It sounds like it's just they're trying to blow it up.
Kristen, what do you think?
I'm a conspiracy theorist, and kind of the whole process to me is putting these people on notice more than anything. I think they probably fired them and then brought them back. The small portion, or let's say less than half, or more than half. But I think that sadly, it's the truth lies somewhere in the middle with a lot of this stuff. I do probably think that there's too many people on the workforce and the communication is poor. And so I see a little bit of both sides, but it is sad because we all deal with the ramifications in our office every day with this. So it's tough, at least more specifically, I think in the population that I serve because we don't take Medicaid, and a lot of our parents are more on the bandwagon of Arizona, which is there's more support for this than not. So I have to spend a lot more time trying to convince people why, even if they do a la carte vaccines or believe that the government is corrupt and whatever, it's tough. So they've blown it up in many ways. I do think there's some good, as you all know. I think that making America's food supply healthier and having the conversation about don't take a drug for everything and recreate your gut health and do all the things that are pretty obvious but just need to be reinforced.
And I think that what's made the AP and the AMA and the American Family of American Family of Family,
American Academy of Family Physicians.
yeah,
Yeah.
very upset is that they fired all the members of the advisor committee immunization practices, and they brought some people that they don't consider to be their peers. Does that sound about right? Is that where the beginning of the unhappening started?
I think so. And in addition to that, with the latest ACIP meeting, they eliminated all the subject matter experts and the liaison organizations from participation in the work groups, which really do the vast majority of the work prior to the meeting itself. And if you were listen to the meeting or watch the video of it, it seemed rather disorganized compared to previous meetings I've seen.
Yeah, but it seems like that meeting, I didn't watch it, but from what I heard, it took a very long time. And the topics of discussions were not that long to talk about. I don't know
Well,
why.
this is what advisory boards are like. You sit in there for 2 days and people present the data, people ask questions, and then they try to come to a consensus of what they're seeing.
But what is this ACIP organization? What does it do really? From my understanding is they're the ones that make the recommended vaccine schedules and the other organizations agree with them. And then I think the insurance carriers actually follow what they say in terms of reimbursement. Am I correct with that or wrong?
You almost got it. So the American Committee on Immunization Practices there is a board of advisors. They're inferior officers under the Constitution. They make only advice. The CDC director was actually a superior officer and therefore has to be confirmed by the Senate on policy for vaccines. Only the CDC director can set policy recommendations for vaccines under the Constitution. That's so that if we don't like it, we can vote them out. We vote them out by voting out the current president. And so that's how that works. And if the CDC adopts the recommendations, which they're not binded to accept them under the ACA, then every non-ERISA plan and I must cover that insurance without any cost sharing for the families. And then the vaccines for children will put those vaccines on the schedule. So that's the implication of that. But they only recommend. Only the states have the right to issue public health law under the Constitution. It's a very complicated mess of democracy, though.
Who's on to these organizations and how long do they stay there for?
Who?
What kind of people are on this organization? How long do they stay there for?
John, do you know? I know they're appointed, but I
don't know if they are term limited or not, or how many years they're allowed to stay.
So that's
have been on the committee for quite a number of years.
Okay.
All right. So my first question, which is, I understand. So I'm going to say something about what John said. So I don't give that much credence to these experts at the CDC. They're government employees and they have a political agenda. And that political agenda depends on who's in the White House. And we saw that through the Biden administration, how they twisted Rachel Walensky's arm to do what they wanted. So back in 2021, this same committee of the experts that the AP likes recommended that only people over 65 receive boosters for COVID. But the Biden administration did not like that political point. Rochelle Walensky disregarded the recommendations both from the CDC and the FDA and went ahead and said, you put the word anyone may receive the COVID vaccine booster. And that was purely politics. It wasn't science. And then I know Dr. Paul Offit has the highest regard for Dr. Fiona Havers, really have a problem with the data she presents. And Dr. Offit agrees that the data is flawed. And the original sin of the data that the doctor presents on COVID is the definition of COVID. Anyone having a positive COVID test by PCR or otherwise for screening or indicated by a physician 14 days prior to hospital admission. And I can't but think that was the White House interfering with science. They wanted to make the problem look as bad as they could in order to make sure that everybody felt guilty about not getting a booster for COVID.
I would actually go back to the Great Barrington Declaration. I think that actually, to me, was probably the most frustrating part of COVID. And then fast forward to the vaccine. I think that planted the seed for exactly what we're seeing today. I'm not in the administration. I'm not in their shoes. I'm not in the AP shoes. But the thing that frustrated me most was that the people who were on that committee were some of the most brilliant minds, and they were pretty much blacklisted and ousted for that particular declaration. And it would have made way more sense. And then you have the domino effect of the vaccine coming out and people being made to feel guilty, losing their livelihood, being forced to take the vaccine when it was experimental. And I just have a different position on it, and I've been very vocal on it. But to me, that was the reason that we have so much doubt in our world and our country in vaccines and the pharmaceutical industry. I mean, just all the things, again, I'm not in their shoes, but follow the science. There was so much that was unscientific in all of the recommendations made, and people aren't dumb. And all you have to do is take a study and either ask John how to interpret it or put it into AI. And people are going to do that now. And yes, the AI will come up with a conclusion a lot of times based on what it senses your bias to be, but you can also put it in anywhere and still have it look at all the things that John does to help us look at studies.
Back then, it was an emergency. They needed to get everybody vaccinated. They needed to prevent the illness from spreading to grandma and killing the elderly and the people with chronic disease. So from that point of view, I understand. What I don't understand is when they were mandating kids in college, that's what people off. I know one thing. I lived this with the swine flu. I lived it with COVID. When the COVID vaccine first came out, what happened? And there was a shortage or there was a restriction. Couldn't get it, limited. Everybody was banging the door to get the vaccine. And then when it was readily available, and then you start putting mandates on this stuff, what happens? Nobody wants it now.
Exactly.
Want to give a vaccine, create a perceived shortage or something, and make it available to people, and people will take it. But the moment you start saying you must do this and throwing the finger at people and making them feel guilty, I think that's the time when you lose.
When you tell people it's a vaccine or it's a disease of the unvaccinated, and you don't acknowledge, I don't know, Tracy Hogue and Vivek Ramaswamy, or not Vivek Vinay Prasad. I think that you have a discussion in a forum of all of the experts. Bring the ACIP people, bring Vinay Prasad, bring Tracy Hogue, bring people who are brilliant, bring, a lot of the people who were into the alternative approaches, put them on a stage and let them debate and let the American people make a judgment for themselves. Make the people who are over 65 stay home if they want to avoid it. I don't know what to say, but I think I'm not in the shoes of those people, but it frustrated me. And I think that the fact that we didn't have shared decision-making during that time, and now we're forced to do shared decision-making, is absolutely disgusting, because I don't like that. I don't think that when we got a letter from the board saying that if we promoted disinformation about the vaccine, what does that mean? Define that for me. Because I certainly allowed people to make the decision on their own, but if they asked me, I was like, I wouldn't give it to my kid. And I had to. He's 16. I'm worried about myocarditis, and I'm not worried about him dying from this virus.
But urgency back
So let me
then
hear
was
that.
in the hospital. We as pediatricians did not live in the hospital.
No,
Right.
we didn't. We
did
didn't,
not-
but we took care of
in the hospital. All the kids we saw, all were fine. I know that. I see a couple of sicklers that ended up getting strokes, and they got into
Mhm.
an acute chest, a couple of asthmatics, all with chronic diseases. It's folk medicine. This thing extrapolates, and it's spread very easily.
All
You know,
right, George, I really have to push back there because this is nonsense. If we're going, if we say we're evidence-based physician and we
was
look
no-
at data,
then it was
no, what you just said is the narrative of the crazies, where when they say that's evidence-based medicine, you're just talking about anecdotal cases of people that got sick with chronic diseases. That sickler could have gotten influenza or rotavirus and gotten dehydrated, and it would have had the same outcome. That asthmatic, you know what's worse than anything else for a kid with asthma? Rhinovirus. That'll put you in the PICU. Okay. So we can't say anecdotally, I saw 2 kids with asthma and COVID, they almost died. Yeah, there's 75 million kids in America. So what does that tell us? Nothing. But the problem is the definitions are not tight, and they're not tight by design because the White House, that was the previous White House, wanted to force the agenda because they were winning on shots on the arm. If you don't give a shot in the arm, then you are not a patriot. And so when you look at the data from the CDC that Dr. Fiona presented and then published in the MMWR, one, you cannot define a disease as a positive test within the last 15 days. That doesn't mean anything. Okay. It wasn't autoantibodies. It wasn't case definitions. It was somebody did a PCR because you were going to have surgery with the wisdom tooth pulled out. And they wanted to make sure you didn't have COVID before you went into the OR. And it turns positive, you're asymptomatic. And then you had a complication with your wisdom tooth. You go into the hospital, and that's a COVID admission.
and
So-
I agree with you.
So that was wrong. Second, they defined not being immunized in 2024 as not having had a booster. And the booster was, you may is a word that Rochelle Walensky used, not recommend. You may. And experts really have said, you don't need a booster if you're 65, you're not pregnant, and you don't need one. So you can't say they're unvaccinated. They don't break them out on who had their primary series, who didn't, who had private COVID. Again, because they want to make it look worse than it seemed. You can pick the definitions you want to make the story with the data you get. And that's what they did. And then the last thing that they did, which is really upsetting, is 70% of the kids who get admitted with COVID have one or more pre-existing condition.
Yes.
So it's really difficult to ferret out. Is it that they're being admitted because they got dehydrated, they have type 1, they went into DKA, and whatever would have made them dehydrated will landed them in the PICU? Doesn't matter. And there's no data on any of that.
Don't forget, they also ignored natural immunity.
Absolutely.
Anthony Fauci never even mentioned natural immunity from an acquired infection. And the question is that if you had an infection and then you got the 2 doses that were recommended, or the opposite, you got 2 doses and then you got COVID, how many boosters do you need after that? Does that really affect your outcome?
And
I could
then
have studied that. Had we had an NIH director with the slightest bit of curiosity, we could have set up many, not necessarily randomized controlled trials, but at least cohort studies going forward to examine these topics. For example, there was a lot of controversy at the ACIP meeting about vaccinating COVID vaccine in pregnancy. Now, we could have looked at that very early on in the course when it first came out, looking at moms who were pregnant, who got the vaccine, moms who didn't get the vaccine, and then follow them prospectively and see what happens to them. Are there any adverse consequences of vaccination or unvaccination during pregnancy? And then what happens to the kids afterward? Are they more likely or less likely to get infected themselves?
That's absolutely right. And then the thing that Dr. Haber just glosses over is that the highest risk group, apart from the over 75 years of age, is infants under 6 months. And guess what? They're the highest risk group for influenza, RSV, rhinovirus, and COVID. Any short incubation mucosal virus that's respiratory on a kid with 4 months of age destroys them. We know this physiologically, they have small airways. They don't have much reserve. All they need is to cough, they get exhausted. And then they can't feed. And there's no strategy. And we're 2025. We've had 5 years to do good studies on what our strategy is to protect this high risk population.
The other thing is the number of kids. Sorry to interrupt.
These people are good people, but the data is very flawed. And they've had time. We're not in an emergency anymore. And so if you're going to make the argument that the previous committee was a bunch of really smart, well-meaning, intelligent, thoughtful vaccinologists and vaccine scientists, they really missed the mark by a mile. And so I'm not sure they deserved their jobs. Or they were political pansies that agreed with the administration and they just were going to allow. Why didn't they all, a couple of people did at the CDC or FDA, resigned when Walensky took that thing back. But why didn't the ACP resign? Why didn't they say this isn't science? This is politics. Back in 2021, they didn't. They kept their jobs.
Why do politicians not resign?
But these are not supposed to be politicians. These are supposed to be experts. And the narrative is that they were the experts that got kicked out, and the people that we have today are just a bunch of Looney Tunes. And I don't think you can make that argument with a straight face. They got it wrong. They got it wrong, and they didn't ask for the right data. They didn't hold the CDC scientists accountable. They didn't push back, and they didn't resign when they didn't get the data they wanted. There's a lot to be done, right?
There is. I'm going to make one more point that's been brought up several times. You look at the stats in the COVID-19 vaccine. John did this summary, and the hospitalizations highest in children less than 6 months, 223 per 100,000. I mean, you don't know the number of kids who weren't tested that did fine. You don't know the number of kids. I feel like the data is so skewed to fit the narrative for people to be fearful. And even when you look at the AAP briefing so many times a week, it's like they put one more thing in there that's a fear factor. They do it on MedPage today. It's not just COVID, it's flu, it's all these things. But COVID specifically, the numbers really did not, the ones that they used to say the number of kids getting hospitalized and whatever, we don't know the actual numbers because lots of people never got tested. The kids that essentially stayed home and they knew their parents were positive and they had a fever, the number of kids are asymptomatic. So we don't really know the numbers. All we know is that the kids who are high risk, to your point, were the ones that were the more likely ones to have a bad outcome. Type 2 diabetics, type 1 diabetics, over kids who are obese, the typical cohort.
Yes, it was the asthmatics, the overweight, the obese, and the diabetics.
And the sicklers.
And it's just, the CDC hasn't been doing the job it should be doing for many years. And it needs to be reformed, probably not the way it is being done now because it's haphazard. But there needs to be some movement back to, we are scientists, and I am not going to sign off on a report on a definition that would never have made it into a peer review study. We just got to move back to the center. So I think my impression is that we all agree. So the AAP could have participated at the last ACIP meeting. It refused. What are your thoughts, John?
I think it was a regrettable decision at best. I understand they were miffed. They got kicked off the work groups and all that, but you don't just take your ball and go home. If you want to be continue to participate, if you want people to still listen to you, you can't just ignore them and go away. I'll give you an example of, there was a Dr. Jason Goldman, who's the ACP president, American College of Physicians, and he had many excellent comments during the entire ACIP meeting in September. As a matter of fact, I think one of his comments on the hepatitis B vote on day one was instrumental in getting the whole hepatitis B vaccine, the birth dose, delayed until 1 month of age in HB surface antigen negative moms. They were going to vote on that on day two, and they ended up tabling it indefinitely. And I think his statement that the whole question that came up for a vote was both inconsistent and contradictory. And it was. And the only reason he was able to do that is because he was actually there. He showed up. What did Woody Allen say? 90% of life is just showing up.
But that's right. And especially when you're elected to be in a position of leadership and you choose to run for the office, or you choose to become CEO of the AAP, you're not drafted into being the CEO of the AAP. You decide you want to be that. And you become a leader, then you have to do what leaders do. And I think they show up, they make the best case forward of why they disagree, and they try to persuade even if it's fruitless.
But I think the leaders are told what they should do.
By whom?
I don't know, some other entities within these white coat organizations. They can't think for themselves.
Or they can't speak for themselves because they're not allowed to.
Exactly.
I think they're
Didn't have anybody from AAP on this podcast.
They won't come.
They won't come on.
They won't
They're
come.
not allowed
really.
to come on. They would love to come on, but they're not allowed to come on.
I'm not sure that the CEO is not allowed to come on. He chooses not to come on.
Yeah.
Yo, the AP.
Who's that?
Mark Damonte? Because we have invited him numerous times.
But
And
maybe he can't. Maybe they've all got some rule that they can't, or they've come up with a rule. Who knows? Because
know
they're maybe
the president, the president-elect, and the immediate past president are not allowed to come on.
wow.
But after they finish their mandates, then they come on.
So what are your thoughts, Kirsten, about the AAP not showing up to the meeting?
I would ditto John. I think they asked for all of our input prior, and not showing up, especially in the position we're in, because this impacts us as pediatricians more than any physicians. We're the ones on the front lines. We're the ones that actually are not getting reimbursed for our time that it's taking to do shared medical decision making on the COVID vaccine. We just spent 3 weeks with a lawyer coming up with a consent form. And I literally have to leave a room seeing patients that are ill and go into a room where the patient's getting their COVID vaccine and go through all the individual things that my malpractice carrier said we have to have in there in order to make certain that we hope not to get sued if there's a bad outcome, because if there is, it's going to happen. And we hope we're protected. But imagine being in my shoes, somebody who, again, if they want it, great. But if they don't, if they ask me my opinion, I'm going to tell them I wouldn't do it. And then I have to go down that path. But most of the people, fortunately, that want it, which is just a tiny number of people, read through those consent forms and sign them right away. And I can go, you understand? Okay, any questions? Okay, you understand the side effects? Okay, you understand the risk? Okay, sign away, and I have to sign. So we're not getting paid for that time, which is frustrating. We're on the front lines, and they should have shown up because we needed them to basically help us. And this was backing away from a fight. And I see why people don't want to vaccinate every single day in my office, because they don't trust. And they just reinforced why by not showing up. So that's my opinion.
And to add to that, the decision that they made back in, was it 2020, when in July they said that they agreed that a school should reopen in the fall, and then 2 or 3 weeks later they flip-flopped. Political interference from the teachers' unions.
Yeah, but medicine should not have politics mixed up.
We live in a democracy. Of course, everything has politics because
Yeah, but medicine should be first. Politics should be underneath, not politics in your face as they are. It's in your face. Name a topic, it's in your face.
what
Wouldn't you think so? That's pharma being part of that big, huge voice. I think that they dictate a lot. I think that you read MedPage, you read the AAP, you can see it intertwined in everything. I do feel like big pharma does a lot of great, but I also think they teach us what drugs to use in med school. They teach us how to diagnose, and then they continually tell us what to do with those drugs, which is great. But I also think that they overstep a lot. I think they dictate how we practice because they're lobbyists, they're wealthy, they contribute to campaigns, and perhaps that shouldn't be allowed. Perhaps we should not allow big pharma to contribute to campaigns. I don't know, but I think that they run the world. They run the country.
well,
Big Pharma, they stopped giving you pens and
I
allowing you
know.
or giving you a drink at a dinner meeting. You're supposed to type 1 diabetes. Dinner meetings, I've been to a couple of Herb's dinner meetings. They're informative.
Mhm.
Now, would I actually maybe read about it? It's on my to-do list, but Herb pounded it into my head to do it by going to his meetings.
so I think that the problem that I see, and we're in the outside, but it just seems like, in particularly American Academy of Pediatrics, always has been left or center. But and that's understandable. If you take the libertarian approach, that Darwin's theory of evolution is what should work. And if you can't feed your kids, then you can't feed your kids. You shouldn't have had 5 kids. That's a libertarian extreme. If you put up a business and COVID hits and you don't have enough savings to maintain the business, your business goes under. That capital gets reallocated and better businesses are built. That's a total libertarian way of thinking. Then you're going to make friends with the left or center who want to treat poverty and want to take care of those who can't take care of themselves. And so that's understandable. You're going to find more common ground. But there's a point where you've gone too far to the left and you just start appearing like a yellow press and a political action committee for the DNC. And it just seems that you don't really care what the policy is. You don't care what the outcome is. You only care to oppose the current White House.
Huh?
And then that sticks wrong to a lot of people. Because if you can show me why you think something's wrong, and then I may or may not agree with you. But when you show me repeatedly that you think things are wrong and they don't seem wrong, and 85% of the people disagree with you, and you're not doing it based on science, then it starts feeling like all they're doing is being part of the resistance. And that doesn't create a lot of good feelings, and it doesn't make people want to support it, or it doesn't make people trust the system. And I think that's really regrettable. And I think from the meeting, the person I really like, my hero in that meeting was Cody Meisner. He's a pediatrician. I think he's a virologist. I believe he's maybe at Tufts. Is he at Tufts, John?
He used to be, now he's at Dartmouth.
And he was very thoughtful and he was prepared. He asked humble questions. I don't understand that question. If you do this and that, what is it we're voting on? And he said it outright. At the beginning, when he talked, he said, the AAP not showing up, you cannot have evidence-based medicine if you don't show up to discuss your points. And it's just making themselves irrelevant.
And making us irrelevant. They represent us.
I don't, but luckily the Pediatric Infectious Disease Society was there and the Adolescent Society of the US was there. So there was pediatricians with backbones that were there as liaisons. and they expressed their feelings, and they were science-based, and they acted like adults in the room. And I think that was a big loss, one that's going to take a lot of time to recover from. Now, I think I'm at a different place than most of you here. I don't understand, and I know the politics, but I don't understand why the AP is fit to be tied because the ACIP said we don't recommend MMRV. 85% of pediatricians and families don't do MMRV. They split the shot. The risk may be minimal, but it's 3 times fold of a febrile seizure. And if I can get the same vaccine efficacy without 3 times the risk of a side effect, especially a febrile seizure, which nobody likes to see a kid seize, why would I die on that hill?
Because it makes headlines.
Particularly
That's why.
since it's been a recommendation since 2010 to split them up for the first
Yeah.
dose.
You know what?
But then also, if you look at the data, there's no data to show that there's any increased amount of febrile seizures for the second dose, regardless of when it's given. And yet they decided to eliminate it or not recommend it, and not even any shared decision making for the kids to get a second dose if they are under age 4. For example, international travel, things like that, if you want to give a combo vaccine with the MRV instead of separately.
Yeah. You know what? In my office, Dr. Reichling, who started our office in 1958, he did not believe in these combo vaccines. He always said that combo vaccines are created for the benefit of the physician that gives his own vaccine, basically not to wrestle with the kid twice. We've never given combo MMR varicella. Nobody ever calls with problems when it's split up. I don't even know why we're talking about this.
We're talking about it because the AP takes a position that 85% of the pediatricians and the parents oppose. And then it's not science-based because it's that simple. If you can, whatever it is, if you can give me a pill as opposed to a shot, as opposed to an IV, and the efficacy is the same, why would I go through an IV where I have more risk of complications, even if it's just theoretical?
I think the reason that they choose to do it because it's VFC, right? That's correct me if I'm wrong. I think the Medicaid population, they do because we've never done the combo MMR varicella vaccine at a year. We've always split them up, and then at 4 we do the combo. But I think what I was trained in residency to do is if you had a kid come in for their first visit at a year, you gave them as many vaccines as possible. And it's nice when you have a combination vaccine because they're going to get as many vaccines as possible because you're not sure if they're going to be able to show up 2 months later or 6 months later. A lot of them have
There's problems.
access problems and they don't have transportation. They don't have, for whatever reason. So you vaccinated the heck out of them. You did it anytime they came in. And I think it's a lot more humane to be able to use the combination vaccines and you go through the risks. I think that's why it is. But I think it was just an interesting thing to focus on. There were so many other things that
So here's my conspiracy theory.
okay.
This is just simple. From the AAP is the resistance. If this administration says the sky is blue, they'll say, no, it's not. You guys are lunatics. That's not blue. It's gray. And here's where I'm getting very nervous, from Secretary Kennedy. He is a very smart tactician. He wants to pick this fight because 85% of the country, doctors and parents, don't want the MMRV at 12 months. And he wins on good grounds. And he erodes credibility on the vaccine. We should have not given him any oxygen. We should have said, sure, don't recommend it. People get the MMR and the varicella and the other thigh. Already 85% of the people are choosing that. So what is there to talk about? Let's move on.
Wow.
Do you,
Yeah.
My
You-
concern is at the end of the meeting, they talked about new work groups that they're going to be setting up. One is for all vaccines in pregnancy they're going to be looking at. And the other one is they're going to look at the entire childhood and adolescent vaccine schedule as opposed to just individual vaccines where they looked at 3 specific vaccines at the. So if you didn't like the deliberations at the last meeting, wait do you see what's coming next? It's not going to be
that'd be pretty.
anything that's going to be, we're going to.
What else did they talk about her?
All right. So this is another bone of contention between the AP and the current administration. The CDC now is recommended that no vaccine have thimerosal as an adjuvant. Now, thimerosal is not an adjuvant, I'm sorry,
Preservative.
as a preservative. Thimerosal does not improve the efficacy of any vaccine. It only prevents bacteria from contaminating multivial doses. In 1999, the American Academy of Pediatric put a policy statement urging everybody, all vaccine manufacturers, to take thimerosal out of all the vaccine supply for children up to the age of 6. And ACIP adopted that 25 years ago.
Why
Now-
are we talking about it today? Because
I
we haven't
get-
had thimerosal on the vaccines for years.
That's
Flu-
right.
Some of the flu vaccines do
No.
though.
Only multivial doses for older than 6 years of age. And the only thing that changed is the ACIP said you can't put thimerosal on any vaccine. We're done with it.
Okay.
Not a big deal, because
Mm-mm.
in pediatrics, that's pretty much been the standard of practice for 20 years.
My entire career, yeah.
And if I'm a parent, this is very personal, but if I'm a parent, like eczema gets better if you do Clorox baths on the kids. I never recommend it. I'm so scared some stupid parent, instead of putting a little bit of Clorox in the bathtub, is going to dump Clorox on top of the kid.
Yeah, but you got Clorox in your swimming pool.
Yeah, but
That-
if
like
you
it-
tell a parent that you can do Clorox bath and it helps with eczema,
Full amount that's diluted, like in your swimming pool, you put a gallon.
I don't trust them. I think they're going to they're going to think the thing and you just put it on the kid and he's going to get a cosmic burn.
That's a
All
little
right.
bit much. I remember when the thimerosal was an issue, they were talking about it's causing problems. Parents were concerned, and it would come to the office. Says, "I don't want that vaccine with that thimerosal. We don't have thimerosal in our vaccines. Don't worry." End of conversation. No more conversation. And we're
Okay.
talking 25 years later.
Okay.
It does not need to be.
So the same concept applies. If you're a parent, I don't think you're unreasonable saying, you know what? I don't want thimerosal in the vaccines for my kids. Is it necessary? No.
We don't have it. Move on.
Does it improve efficacy? No.
We don't have it.
It's okay.
Now it's aluminum though, the adjuvant that's going to be, I'm like, okay, the air you breathe, your breast milk, like you can go through all of that.
Why do you pick that fight?
Yep,
Because
they're-
it makes headline. Thimerosal
Mhm.
sound. And mercury.
Mhm.
Why do you make that argument that the current ACIP committee is a bunch of lunatics when you wrote the same thing 25 years ago in a policy statement, and that is the standard of care for U.S. kids? Why do you oppose it?
It's oxygen. It just
It's not just the U.S. A lot of European countries don't use it either. Yeah, they don't have multi-dose vials for that reason.
Why do you oppose it? Is it just because you're the resistance and you have to oppose everything that comes out of this administration? Or what is driving you to be so vocal about something that was settled 25 years ago? Even if it doesn't cause any harm, it's settled, it's done, it's water under the bridge. What
Well,
drives you?
politics, not medicine. Politics.
The concern is that the academy is losing credibility day after day, week after week.
Losing
And,
credibility.
and
into the-
when the next big problem comes up that really is a problem and they want to make a statement about it, nobody's going to listen to them when they should.
Yeah. And the optics don't look good. And that's what the problem is. They're good people. They're our colleagues and they mean well for the kids. but they really don't know how to communicate and they don't know how to play politics. They should stay out of both of those because they don't know how to do it.
What else did you talk about, Herb?
Hepatitis B, and John and I disagree on this one. John,
Let's go.
Just going by the evidence that they presented at the meeting, everybody says, oh, you don't need a birth dose because women are screened. And if they're negative, we can just wait till a month of age. And these kids, who needs the hepatitis B vaccine anyway until they start having sex at whatever age, is a teenager or later. And all of those things that from the facts that the CDC's expert presented were not true. You can get hepatitis B from casual contact with infected fluids. They can stay viable on surfaces for 7 days. And even though there's a recommendation from the U.S. Preventative Services Task Force to screen all pregnant women, then most of them just do it at the very first visit where they're first diagnosed as being pregnant, and that they deal with it. But if they're negative, then they do not repeat it, and they don't have a recommendation to repeat it at the time of delivery, either immediately before delivery when they're in labor, or if they have a precipitous delivery, immediately after the baby's delivered. And the recommendation that the ACIP passed to mandate screening also does not address that. A lot of things can happen in 9 months of pregnancy, and women can get exposed from partners and things like that, and they can acquire an infection. That's why the hepatitis B virus vaccine is recommended as a birth dose and has been for decades. And I think it was about 15 or 20 years ago where they recommended it, not only just giving it at birth before the baby goes home, but within the first 24 hours. And so is it a large number of kids? Probably not, but a significant number of people carry hepatitis B virus. And 50% of them are asymptomatic at the current time. So they don't even know they have it.
all right.
So that's the point of the birth dose. And they really didn't present any evidence at all to show that there's a current problem giving it at birth versus giving it at 30 days. So it all makes no sense. They came up with a solution to a problem that apparently doesn't exist.
But now it created a problem in my examination role because the people know about this and they're saying, I want to delay. I've never seen people wanting to delay the hepatitis B. Now I'm seeing it over and over again. I'm compromising. I give it 2 weeks. I'm not going to fight with them to take it at the hospital. If they don't want to do it, they don't do it. But
It's the first 72 hours that provides the protection, though, right? You have to give it within. John, correct me if I'm right. If you don't, then it's not that 2 weeks isn't great or whatever, but if you're going to do it to protect the baby, then they have to understand that first 72 hours is critical. I don't understand it either, John. You make a good point. Like, we test for group B strep. Why wouldn't they just do a hepatitis B screening as well? Like,
it's done earlier in pregnancy. They don't repeat it again later. And sometimes the studies were done for inner cities where there's lack of prenatal care often, or lack of records proving the prenatal care results. So because they have to have a big catchment area, a big window, they just throw everybody into there. People in Long Island, they all have prenatal care and they all had the hepatitis B negative. How do you argue with that mom? I go to the doctor and my test is negative. I don't want to give it to a baby that young. Let the baby breathe, let the baby eat. How do you argue that with her?
Well,
you're saying that they do it right before the baby's delivered, the hepatitis B test? They do it at the beginning of the pregnancy.
In the pregnancy.
So my argument would be like what John's saying is do it right before delivery so that just like group B strep, if it's positive, then the kid's going to need the hepatitis B. If it's negative, then you go, okay, great, delay it. And then group B strep, it's the same concept. Why wouldn't we just throw that into the screen right before they deliver? Group B strep is 36 weeks. But to the point I'm making, I think.
So I had the answer for you.
Okay.
This is DEI policy. Because it was brought up. So there's a couple of nuances. The rate of hepatitis B infection among U.S. born expectant mothers is approaching 0. For a U.S. born mother, because they were vaccinated. Remember This vaccine's been out since 1992. So these people were 40 years old when started getting it. Number two, the argument that people will make is if you don't get it within 24 hours and you do get infected, the younger you are when you acquire hepatitis B, the greater the risk of cancer of the liver. Number three, and they brought this up at the meeting, they said, we know that hepatitis B in expectant mothers is only seen in the U.S. in non-U.S. born women from Asia and Africa. And then the DI corps jumped up and down saying, we cannot stigmatize people of color. You cannot think of a kid who's not white with pain and fever. Does he have sickle cell? Because you're stigmatizing. It is not science. And if you only give the hepatitis B vaccine and you don't give the immunoglobulin because you don't know the immediate pre-delivery status of the antigen, you only get 60% prevention. You have to get both shots, the immunoglobulin and the hepatitis, at different sites in order to prevent infection from the mother to the infant at birth. But all these things are not said. And if you chat GPT it and you find these out, then you don't sound trustworthy. So it is not to me. And then we've done something horrible, right? I think we're all maybe not Christian, but the rest of us are old enough, where we kept moms in the hospital for 3 days when they delivered. Now they barely keep them overnight. Mm-hmm. I honestly cannot imagine being pregnant for 9 months, delivering a baby. Everything is going so fast. I'm trying to get that baby to breastfeed. And they come in with a list of things I have to consent to. And I'm already deprived, in pain, exhausted. And I'd be overwhelmed. I'd just say, what do I need to do right now? What can I get my head out of the water and think about it? And then, worse yet, it's an NP or a PA that works with a neonatologist that doesn't know the family, doesn't have a relationship with the family, is never going to see them again. It's got their nose buried in Epic and says, this is what we do. And you wonder why people say, do I really need to do this? We have no relationship. We're rushing through it. We don't give all the information. I find it totally reasonable. I want to go to my pediatrician and have a conversation with them. See what their take on this is. When I'm not exhausted, sleep deprived, and in pain.
Makes sense to me.
And I just wanted to do the vitamin K shot. I'm like, please, because.
Do the vitamin K, do the urethra, for God's sake. But if you say, I was born in the US, I was vaccinated, that vaccine is extremely effective, decades out. Even if your husband cheated on you while you were pregnant and then had intercourse with you, you're not likely to get infected. The problem is you don't know what a legal immigrant is around your kid who did not go through the immigration process, because I got a green card to come to the US. They drew my blood for syphilis, HIV. They did a chest x-ray. They made sure I didn't have tuberculosis. Otherwise, you don't get the green card. Hepatitis B. But an illegal immigrant born overseas in a country that doesn't vaccinate with hepatitis B can spit on your kid's eyeball and your kid's now got hepatitis B.
What about those kids that go to daycare and they get bit?
That's right. And if that kid has hepatitis B, your kid now has hepatitis B.
Or they go to a park and there's a needle in the sand and they step on it. What?
That's not going to happen.
It can.
Never. It does. The beaches, the walk around San Francisco, you're like, okay.
So there is a risk it is a very small risk. The vaccine is incredibly safe and effective. But I just think we have to be a little bit more nuanced and a little bit more empathetic to the overwhelming moment. I've never delivered a baby. I'll never deliver a baby. It's not possible. I'm a male. So I can't speak to how it feels. Maybe Kristen can say, but it seems like it's an overwhelming moment.
It is.
Yeah. I
And so,
know what I would do if obviously I probably wouldn't do it. I had the vaccine. I would just wait until I did the Vaxalis at 2 months and then do the series. And that's another pushback that people are doing because we do it at birth and then they get the 2-month Vaxalis, then they get the 4-month Vaxalis and the 6-month Vaxalis. And now people are pushing back and saying, why are you giving my kid an extra hepatitis B at 4 months? And I'm like, okay, now we need to switch to Pentosil because people are concerned about getting an extra hepatitis B. So if they get it at birth and then get the 2-month, 4-month, 6-month, and then we do Pentosil at 15 months to have that combination vaccine. So effectively they're getting an extra polio. It's not going to hurt them, but at this point, I mean, I think they want to be informed. I don't think that they have a problem with it when you discuss it with them, but because it isn't a problem, but I don't know, in this new world, you're giving oxygen to something that really doesn't need to have oxygen, like you said. And he continues to plant more seeds by bringing things up that are really irrelevant. I think.
It's fine.
Mhm.
It's fine.
yeah, both sides are playing politics, and it's
Mhm.
dangerous because they're playing with our lives. And George got interviewed in Long Island, and I think it's hilarious the difference between the way a practicing physician has empathy and understanding of the nuances of human beings versus the system. What did you say, George? And what did the behemoth say in Long Island?
The behemoth says we practice evidence-based medicines that's prescribed by the academies, and we don't deviate. Independent practices, we speak to patients and we talk to them, and we tell them what they should do, not what they must do. And we give them experience, and we tell them that, but for the very, very important illnesses, the deadly illnesses like Haemophilus, Prev, and pneumococcal, and it's not negotiable. They have to get that. The little ones, you can have a conversation. It's all about having a conversation with people. Don't be
And
so.
and the stress factor, they're your patients.
You know what's interesting? Our vaccination rate for 98%. Go figure.
I had the same experience when I was in practice. I even had over a 95% HPV uptake in all my adolescents.
Yeah.
Great.
It's all the way how you present it.
It's how you talk. Is there? It's funny because I have my medical students. They'll walk into a room, they'll talk to them, they'll tell them you should get this. Oh, I don't want that. I don't want that. I don't want that. Dr. Roda walks in the room, blah, 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 do our thing. We start talking about, and they're amazed how I walk out and the people accept the vaccines that they just refused with the student. How is that possible? It's how you.
They trust you because they know you.
And they'll trust you more if you're reasonable.
Yeah.
And if you say, this is what I did with my kid, I would never harm my kid, I will always be forthright up front and tell you, I would never harm my child. This is what I do. This is what I would recommend. So,
Listen
Yeah.
to you.
Yeah.
But we do have the relationship that behemoths don't. They have.
They do, and they have a one system fits all. And that doesn't work for humans
No.
because we're all idiosyncratic. So I feel that your pain point with the shared decision making, but on the COVID. But don't you think it's better than blanket mandates of everybody should get a booster every year, no matter what?
I do. I guess my problem is during COVID, we didn't have any sort of shared decision making. We couldn't really express our opposition to the vaccine. We had to basically, because they never really defined what disinformation was, we couldn't promote disinformation. And what does that mean? I actually wrote them back and said, could you please define what disinformation is and who the judge is, because I want to be able to speak my mind. I wouldn't have prescribed ivermectin, but that's a safe drug. And if doctors wanted to prescribe ivermectin, we prescribe stuff off label all the time. It was very draconian and it was very problematic. And that's where we lost trust. Doctors should be able to practice medicine and to be thrown constantly the phrase that follow the science. So much of it was so unscientific. Stand 3 feet away, then stand 6 feet away. Mask, don't mask. Like, it just, to me, it essentially created such a huge burden of mistrust. And now we have given RFK Jr. so much oxygen that anything he says is given oxygen. And his advice to all the people around him, sadly, everything's taken as absolute fact. And so we have to constantly say, holy cow. I agree again with all of the Make America Healthy Again. And I think it's interesting now that with food dyes and when they keep talking about things that he's talking about, I actually am happy they're doing that. But it's just a mess. And I think over time, the pendulum will swing back. You're right. But we are so far over here now. It's frustrating. And so I think that's
John, what?
That's a big question. There's so much distrust. One statistic, something like 25% of people think that they know someone who died from the COVID vaccine. That's amazing.
That's interesting.
And, so there's a lot of distrust among the general public in terms of these experts and public health people. How do we get that back? I don't think we're doing a good job getting it back right now with the current strategy.
No.
Well, didn't you think that what Kristen said a little while before, and we've talked about many times, if you do not choose the experts, you don't handpick the experts like the AP does. You reasonably invite experts into the room. And the expert may not be a physician. It may be a public health person, an MPH. And you have an honest dialogue. And then you write a consensus statement. And then people who don't agree with the consensus statement write a dissenting statement, explaining why they dissent. What are they afraid of? What are they seeing that is different from what the consensus was, the majority opinion? And then people can read that if they choose to. And then they can make up their own minds. We just need to trust people in a democracy. That the beauty of the democracy is that people, some of the time, will make the best choice for themselves and their communities. We don't have to shove it down their throats. That doesn't work in a democracy. So give people information. Be transparent. Don't you think, John, that would get us somewhere closer?
I think there has to be a commitment to following evidence and good evidence. There's science and then there's junk science. And a lot of what makes the headlines is junk science, mostly based on observational studies, which cannot prove cause and effect. And you sometimes get a lot of confirmation bias. And the problem with that is that's not, you're not giving real information. You're not giving people data that they can make intelligent decisions about.
That's for having someone like you, John, and, them picking people who can think on their feet and bring up concepts like confirmation bias. You've taught us so much about that. Have somebody like you, have somebody like Offit, have Vinay Prasad, have people, Tracy Hogue, have all of these experts that I can't remember the infectious disease doctor from Dartmouth's name offhand. I'm forgetting it, but have a forum of people and have them introduce themselves and why it is what they bring to the table, and have all the people from the wellness company and all the people who are in such opposition, put RFK Jr. up there, let them all have a conversation and not necessarily see who wins, but show them that we aren't coming at this from just wanting to be a sheeple, that we actually believe in this stuff, that You've seen cases of Haemophilus influenza, epiglottitis, and seen kids die. You've seen kids with meningococcemia lose their limbs. I took care of a patient with pneumococcal meningitis. He was deaf and he was intubated. There's cases in Oregon. I don't know. Just bring people up on the stage and let them talk and let them help the general public regain trust, because they will actually present facts, present reasons to trust, reestablish that. We're not going to do that by not coming to the ACIP meeting. We're not going to do that by not having some way of saying, okay, what's the root cause? How do we fix this? By like demonstrating to the general public that there are true experts that believe in the true science of vaccines.
But I think you have to be inclusive. I think we have to listen to parents because their fears are real. They may not be scientifically grounded, but their fears are real. And to not acknowledge fear doesn't help us regain their trust. And I can acknowledge your fear. Like you can tell me, I don't want to see when you give my baby a shot. That's your fear. You don't want to see that needle in your kid's thigh because it's going to hurt. I say, okay, turn around. I'll do it. Because it's a shot, kid's not going to remember. But if I say, oh, you're being a wuss, hold the thigh while I get the shot.
Or just listen to me because I'm the doctor and you're the patient.
Yeah.
Don't, like, your job is to listen, establish trust, teach, and ultimately to not judge if they choose to not succumb to your recommendations. Now you can say, sorry, you can't keep coming to the practice if you don't, but because you're putting my other patients at risk.
Yeah.
But
and then, John, do you think that shared decision making on the COVID vaccine is that dangerous to the public?
I was reading, there was a Dr. Henry Bernstein who filed a minority work group opinion about shared decision making. And he had couple of good points. I'll quote a couple of things that he said. With routine or age or risk-based recommendations, the default is to vaccinate all patients who consent. However, recommendations with shared decision making are perceived differently. Shared decision making has no default. Vaccination is interpreted as optional. There might be some optional vaccines out there based on risk and things like that. And then there are others that we feel very strongly about, which George mentioned earlier.
But on COVID, do you think that shared decision making is such a terrible idea?
No, I don't think it's a terrible idea. I think that everybody who gets a vaccine is like any other treatment. You should be told about the risks and the benefits of it.
exactly.
What I think was happening at the ACIP meeting was that a deliberate attempt to make it so onerous that people will just give up and not want to do it. I think there was an ulterior motive involved, but maybe that's just me.
No, I think you're right. I think both sides are playing politics and they're playing with our lives. And yes,
You have to ask yourself, though, the shared medical decision making, correct me if I'm wrong, but you're basically then, you're going to take responsibility as the pediatrician if there's a bad outcome. You're actually shifting the blame. You're taking it on now. It's doctor, you're the one who recommended this to me. You didn't dissuade me from getting it. You're now responsible. No longer is it going to a vaccine clinic and the government paying for it and recommending it. It is now you, doctor, that had this shared decision making, and I had a bad outcome. So are we actually, in fact, we're the scapegoats if something goes wrong? That's what makes me nervous.
I think there's 2 points to that. So
Okay.
neither Beyfortus, which is not a vaccine, nor the COVID vaccine has gotten into the Vaccine Protection Act. And that takes an act of Congress. Congress has to put that antigen into and attach a tariff to it, vaccine tax, in order to go through that system. And then the other vaccines are there, so you don't have any liability unless you didn't give the patient the this vaccine, which is shared decision making, and unless you were negligent. then they can't sue you. They have to go through that compensation system. The other one is a basic principle of informed consent, as I understand it. If you tell the patient what the possible side effects are of any intervention, and they experience one of the side effects, that's usually not something that you can sue, but you're not going to be successful. It's only when you don't share the possible side effects of an intervention, so you didn't allow the person to make informed consent, that you can get in trouble. So if a surgeon doesn't disclose that if I replace your knee, there's a possibility there's going to be infection, bleeding, sepsis, or a complication of anesthesia that are rare, but they could happen, and the knee gets infected, they can sue you. But if you disclose that and the patient signed the consent that they were willing to take those side effects, and it was through no negligence of your own, then they have a really hard time proving their case in court. They can still sue you. Anybody can sue you for anything. It just won't be successful. So I think the problem with this COVID vaccine, there's no tariff on it. So it's not part of the Vaccine Compensation Act. And who knows if we can get Congress to agree on anything.
Yeah.
That's a problem. So that's where the liability comes with this vaccine.
Probably should. And that was one of the points of the new VIS sheets, is that they all should have information about the vaccine injury compensation program. But that's a good point about the COVID vaccine. It should be part of it.
Yeah. And then remember in the old days when we were in paper, we had one sheet where the vaccines were, and there was a section for the parent to sign that they had received the VIS sheet. And that there was one little thing in front of the chart. And now most EHRs don't have a place where the parents can sign.
No. You
take it as a given that they read the VIS sheet or that they were giving the VIS sheet, but sometimes they're not even giving the VIS sheet.
Yeah, nobody ever looked at that. We used to give the paper version of it. They used to be all over the parking lot.
We have a folder that they look at with every single vaccine in there and the manufacturer. And then before they have the vaccine, they sign off and the lot numbers there and everything. But they don't think they read it either. But still, it's been presented and you go through.
If they don't want it's a problem, but you should give it to them. And so here's where because I agree with John, there's nefarious reasons, and it's all politics, behind both sides. And they're doing more harm than they're doing good. And this really scares me.
Yeah.
The HHS subsecretary, who's the acting CDC director, put out a tweet thanking President Trump for his efforts to break up MMR into 3 separate components. Just to level set, no one manufactures single antigen measles, mumps, or rubella vaccine. In order to get them, they would need FDA approval, which can take years. And the factories would have to be built. And then they would have to be inspected and accredited by the FDA.
When I first started practice, they were individualized. You guys have been there longer, but I guess.
Yeah, I think I'm the only one here who's old enough to for the single dose before they combine them into the MMR. We thought it was the greatest thing since sliced bread to not have to give those kids those extra 2 shots.
And it was right when I started practicing, and there was the Andrew Wakefield was really getting oxygen, and then they combined it, and so many parents were upset. But it made for really making sure that there was I felt it just added another problem to the ever evolving anti-vax situation, and just being EMR would make it a lot easier because the precision is much greater with it popping up and telling you it's only been 29 days, you can't do it, or it's only been, but it was just it's another shot. It's more, you say there's more preservative, there's more adjuvant, there's more this, there's more that. Put it all in one. And do you guys find that, or John, since you used it so much more, do you find that the fever profile, that the side effects are greater with the combination? Oh,
Yeah, you're talking about the
the-
AV or?
yeah, just the MR itself, like when it was broken up into measles and then mumps
Oh
and
gosh,
rubella.
I
I
don't
mean,
remember. We hardly ever got calls. The only thing we got a lot of calls about was the whole cell DPT vaccine.
okay.
And I lived through that whole chaotic 1980s where we almost didn't. As a matter of fact, there was a time there about a year where we didn't have DPT. We could only give DT. And that's because of the shortage of production. So they ended up doing an acellular pertussis vaccine, which has not been improved upon in 30 years. And really, compared to the immunity from the DPT vaccine, the whole cell vaccine, it's terrible. It's not very long lasting. And,
Got a lot of positives.
so you eliminated one problem and you created a new one.
Yeah.
That's interesting.
So you're right, Kristen. This is all coming from Wakefield, who said if you just split the MMR into 3 and his bogus studies, you won't have autism. My fear is that this is intentional. So they picked a fight with the MRV versus the MMR plus V at 12 months. They won. They won on the thimerosal. They won on shared decision making on COVID because that's what the U.S. population and most doctors want. There's many pediatric clinics that are not even buying the COVID vaccine. And now they're going to push to split the MMR into 3, and there's just not the supply chain to do it. And that's a way that Secretary Kennedy and his minions want to stop even measles vaccines in the U.S. And that is dangerous.
Remember this, Herb, because as the EBM guy here, if the Lancet had the guts not to publish Wakefield study, a lot of this mess wouldn't be around right now. But once it was published, the damage is done, even though it's retracted.
Yeah, but the problem is that this hits at the supply chain. And the supply chain for vaccines and pharmaceuticals and biologicals needs a very long runway.
Another problem is RFK Jr.'s continual stance on the measles vaccine and the lack of knowledge in the sense that it was the diluent that was contaminated that caused the death of those kids. And then the entire island didn't vaccinate. And then a number of kids died because of the measles. It's just a way to twist the narrative. And it's a shame because people actually look at the actual story, the rest of the story, they would realize, but they're not going to do that because somehow it's going to be, we're just making it up. There's no evidence to that. We're trying to, people just don't trust. And he, like you said, we're just giving him more and more oxygen with stuff that really we need to pick our battles with, and we're not. And then we don't even go to battle and we don't show up.
The MMR, splitting the MMR is really dangerous. That really concerns me. I think that is one to fight and fight vigorously and loudly against any thought that is even possible. Because there's no science behind it. It is just an attempt to disrupt the supply chain so parents don't have a choice as to vaccinating their kids with measles.
That's a theory of yours, Herb.
John, am I far
I
off?
don't know if that's real or not. It sounds real. That's like the ultimate. I didn't even think of that one.
John, am I far off?
I'm a pro-vaccine guy. I've seen almost every vaccine that we give. I've seen the disease entity, except for tetanus. I've never seen a case of tetanus, but I even had one case of diphtheria.
Really?
I think they're a miracle. But you got to remember, there's a risk and a benefit to everything we do in medicine. And the benefit of vaccine and not having to see these kids get these diseases so outweighs the very small risks that have been proven or documented. It's like night and day. But people don't understand relative risk, whether it's not, we're not teaching it in math these days, but that's a very important point.
I mean, leave you with this, but doing nothing is also a risk.
Yeah.
High risk.
Well, and John, that's where like you and Milton, my co-manager, my business partner, people who have been on the front lines in the storm, who have lost several patients a year to these different diseases, who've seen parents cry over their children, to give all these examples in a public forum. I know we were that if he was doing the campaign of us talking about this online, that really didn't go very far. Why not pay for commercials, put it in the just public service announcements with doctors like yourself who sit around in a round table and say, okay, so what did you see 10 years ago, 20 years ago? Tell me about your experience in a just little snippet. And that is what would convince people. Right now, it's tough. It's tough. And what it's going to take is more and more kids dying from these things. And I don't even think those are particularly well publicized. That's the stuff that is going to help reestablish trust. And doing nothing, to George's point, we're basically just allowing more and more distrust and less.
In some ways, vaccines are a victim of their own success. And when people don't see these diseases, that they lose interest in them. They don't understand. I grew up in the 1950s when everybody was scared to death of polio. And people were in lines around the block to get the Salk vaccine when it first came out. And even when they had that horrible side effect through the Cutter incident that Paul Offit wrote about a number of years ago, even after that happened, they still wanted it. They were still desperate for it. And if you remember back 5 years ago, the COVID vaccine, when it first came out, don't you remember there were football stadiums where people would drive up and the parking lots were full of cars and they would just go from one to the other? There wasn't sitting down discussing the pros and cons and the risks and benefits for 10 minutes for each individual car. They would drive up, get their shot, drive away. That was it. People change their thoughts about it over time. And once they don't see a disease or a crisis, we reflexively act to crises rather than deliberating over what should be done.
No, but
Great, Herb. Let's wrap this up. We've already went over a long time ago.
We're trying to compete with Joe Rogan. Any parting thoughts, Kristen?
no, this is really a fun discussion. I like that's why we have our little Peds United group. It's fun to just learn from each other and to just establish more of a backbone and a position as to how we feel. So I appreciate being on here, and I appreciate you all continuously spreading your knowledge through that, and just having respectful conversations where we can agree to disagree constantly. And I just love that's what the world needs, is to love people despite our differences. So thanks for doing this podcast too. I really commend you guys for doing this. It's great. So
Thanks.
We need to keep talking. More speech, free speech, no censored speech.
yes.
Yeah. Yeah. It's always a joy being surrounded by colleagues like you two. That's what makes a podcast special.
Thank
And
you.
candid, open conversations, because some of this is not as black and white as people think. There are nuances to what we do, and we're not getting the right guidance right now as to how to manage the nuances to keep our parents trusting us and doing what they need to do for their kids.
Agreed.
I have to go. The chainsaws are out back removing that tree from my driveway. So it's been a pleasure to see all of you. Take care.
Take care. Have a good day, guys.
Thank you for listening. This has been a production of the Pediatric Lounge. On the show notes, you will find links to our co-host and other important notes, as well as a timetable of the topics discussed today. Don't forget to follow us on social media and subscribe to wherever you listen to your podcast. Leave us a great review, as it helps us greatly. In the meantime, we will see you next week. The Pediatric Lounge. The conversations are not intended as medical advice, and the opinions expressed are solely those of the host and the guest.